Hi, my name is Claire Pueller, and this is my project for research for Cobenfy for schizophrenia patients. Today we'll be talking about schizophrenia, a serious mental health condition that affects how people think, feel, and behave. We'll cover its symptoms, causes, treatments, and the role of medications like clozapine or Cobenfy in managing the illness. What is schizophrenia? Schizophrenia is a chronic brain disorder that disrupts a person's perception of reality. This can include symptoms like hallucinations, delusions, and disorganized thinking. It's a complex condition with both psychotic symptoms like hearing voices or seeing things that aren't there, and cognitive symptoms like difficulty thinking clearly or concentrating. Schizophrenia typically begins in late adolescence or early adulthood and affects only about 1% of the global population. Some causes are likely a mix of genetics, brain chemistry, and environmental factors. Causes and risk factors of schizophrenia. All of these factors, such as genetic, brain chemistry, environmental factors, prenatal and early life factors, and psychological factors, all go into the causes and risks of schizophrenia. For genetics, family history increases the risk, as well as having a first-degree relative also has a higher risk. Brain structure and chemistry. With schizophrenia, it causes imbalances in dopamine and glutamate, and also causes enlarged ventricles and reduced gray matter in the brain. For prenatal and early life factors, maternal malnutrition, infections, or stress during pregnancy, as well as birth complications or exposure to toxins, can also be a risk factor for schizophrenia. Environmental stressors and psychosocial or psychological factors are also the causes of schizophrenia, whether that's stressful life events. Examples are trauma and abuse, or drug use during adolescence. Psychosocial factors are childhood adversity or trauma, and also dysfunctional family dynamics. So let's get into Cobenfy. What is Cobenfy? Cobenfy is a second-generation atypical antipsychotic medication, and it is considered one of the best and most effective treatments for treatment-resistant schizophrenia. It works by affecting multiple brain chemicals, especially dopamine and serotonin, which play key roles in mood, behavior, and perception. Cobenfy is typically prescribed when patients have not responded to other antipsychotics. This is what it means when it means treatment-resistant schizophrenia. Some common side effects of Cobenfy are sedation, weight gain, risk of low white blood cell count, which also requires normal blood tests. So how does Cobenfy help treat schizophrenia? Cobenfy helps treat schizophrenia with reducing psychotic symptoms, so helps decrease hallucinations, delusions, and disorganized thinking, targets brain chemistry, so modulates dopamine and serotonin to balance brain activity, improving mood and cognition. It's effective for treatment-resistant cases, often used when other antipsychotic medications fail to work effectively, and improves social and cognitive functioning, so this can help restore some ability to engage socially and improve cognitive processing in patients. Some key benefits of clozapine or Cobenfy in schizophrenia treatment is that Cobenfy has shown significant benefits in reducing both positive and negative symptoms of schizophrenia. One of its most important advantages is that it reduces the risk of suicide in patients with schizophrenia, something that other antipsychotics are not effective at addressing. For many patients who don't find relief with other medications, Cobenfy can significantly improve their quality of life, functioning, and symptom control. Cobenfy targets specific receptors in the brain, particularly dopamine and serotonin receptors. By modulating dopamine, Cobenfy helps reduce positive symptoms of schizophrenia like hallucinations and delusions. The serotonin action is important for improving negative symptoms such as lack of motivation, emotional flatness, and social withdrawals. Unlike older antipsychotics, Cobenfy has a lower risk of causing motor side effects like tremors or rigidity, which are common with first-generation antipsychotics. For the success rate of Cobenfy, it has been super successful so far due to it being a new drug of 2024. So there was a recent study done with schizophrenia patients and placebo effect. So, with the actual Cobenfy medication, by week 52 of the study, 30% of patients showed a 30% or greater improvement in their schizophrenia symptoms as measured by the PANSS scale. On average, participants experienced a 5.5 point decrease in their PANSS scores, indicating a reduction in the severity of their symptoms over the year. The PANSS scale is a critical tool for understanding and tracking the severity and progress of schizophrenia symptoms, and it helps clinicians assess the effectiveness of treatments for the disorder of schizophrenia. In conclusion, Cobenfy is an important medication in the treatment of treatment-resistant schizophrenia. It offers significant benefits, especially in reducing positive and negative symptoms, as well as decreasing the risk of suicide. Despite its effectiveness, it requires careful monitoring due to potential serious side effects. It's usually prescribed when other antipsychotics have not been effective. Ongoing research and clinical experience continue to refine the use of Cobenfy to improve the lives of patients with schizophrenia. But other than that, thank you for watching and listening.